I really do want to take note of Deputy Healy Rae's empathy for those who are forced to travel for healthcare. It is a terrible thing to be forced out of your own county, out of your own town, and indeed out of your own country to access healthcare. And that is disgraceful that people have to go by busloads to get their eyes or their hips treated to Northern Ireland. And so I'm sure Deputy Healy Rae is full of empathy for women and young girls and trans people who are forced onto boats and planes on a daily basis for years and years and years in this country, with the stigma, the fear and the exclusion that goes with it, and very often having to pay out a hell of a lot of money to do so, and very often having to live with the crisis pregnancy because they don't have the money to do so. So I note that the amendments that Deputy Carol Nolan is putting in have everything to do with the public purse and very little to do with how an abortion procedure is carried out. But of course, most of our speech was dedicated to that. And I can see that this is where this debate is going to go for several deputies in the House. And you mentioned we're 158 Democrats and we all have a right to speak, absolutely. But the vast, vast majority of people in this country have already said yes to abortion rights. And what we need to be addressing here is fine-tuning a bill that is long overdue. When Deputy Healy Rae says the Minister is rushing it through, I'm going to defend the Minister here, something I wouldn't do very often for a Fine Gael Minister. But we've been through a long process of 12 weeks of a committee which scrutinised the whole issue of the Citizens' Assembly recommendations that went through weeks and weeks of saying beforehand. This time last year we weren't even sure if we were going to have a referendum. And now, a year later, we're in a position where we're here before the Dáil to legislate for abortion in this country. And I think that's a major and an amazing step forward. And the only thing I can say to the deputies who sound like they want to do this for the next 3 days, go on and on about stuff is not related to the amendments, is irrelevant, because the people in their own constituencies, by clear majorities, have told them that they want legislation for women to have access to abortion in this country. And they didn't say, we only want rich women to have access, so therefore don't pay for it or don't allow it through the public health service. They didn't say, we only want privileged people to have access. That wasn't what they were asked. They were asked to repeal the 8th Amendment so that finally we could have access to termination and abortion in this country. This is what this bill is setting out to do. And as I say, I note the empathy for people who have to travel. I note the distraction onto other issues that have absolutely nothing to do with one's own amendments, Deputy Nolan. But on the other hand, I will say this, that it's a sorry day for the people of Ireland, a sorry 3 days, if we have to listen to people ignoring the democratic will of the people, because it was decisive. It wasn't kind of ambiguous, maybe, if not, what we're not sure. It was absolutely decisive, so we're setting out to do that here today. And just the last word about the actual amendment and the 4 or 5 that follow towards the end of the bill. You see, and I think it was already said by other deputies, if we want to live in a country that's full of inequalities, then, you know, we would support these amendments. We would say, yeah, well, if you're rich, you go and pay for it. But if you're not rich, you're going to have to either do without it or possibly illegally, and here's the thing, illegally access the abortion pill on the internet. Because more than 90%, there's some disputes about the figures, but somewhere between 90 and 98% of abortions take place before the 12 weeks gestation, which means that the pill is safe to cover them. And if the pill is safe to cover them, then if you don't provide abortion services through the medical service, then women and girls and trans people will access the pill illegally on the internet and will, in a lonely space, take that pill and in a lonely space risk their own health.